I'm here today with Brooke Molina PhD. She's a professor of psychiatry and psychology at the University of Pittsburgh. She's going to be speaking at the 7th annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders. That meeting is happening January 15th to 17th, 2016 at the Mandarin Oriental Hotel in Washington, D.C. And Brooke will be delivering a presentation entitled ADHD and the Risk for Substance Use Disorder: Developmental Considerations, Potential Pathways, and Opportunities for Research. Brooke, can you tell us what you'll be talking about?
Sure, I'm happy to. I conduct research on the connection between ADHD and substance abuse. My research started about 20 years ago when researchers began to be interested in a possible link between these two problems. And as we started to dig into it, we discovered that indeed there is a connection. But what remains somewhat complicated is the extent to which there is a connection. So just how much are these children at risk for which substances: alcohol, marijuana, cigarettes, and when they are at risk, why? So I'll be talking about that.
And does this apply also to adults?
Absolutely, it applies to adults. And so much of our research has actually been following these children into adult, understand how long this risk lasts. Some folks have the apparent risk at different stages of their lives, and depending on how you study the question, it shows up differently at different ages, and that's the developmental component to my talk.
Can you give us one pearl before the meeting? What's one really significant point you've found?
Well, some people were surprised that we found that the most common treatment for ADHD, stimulant medication, did not have a clear and strong signal for preventing substance abuse. Some studies are showing that it helps, and some studies are not showing anything. The good news is that it doesn't appear to visibly be harming children or to be escalating their risk for abuse. We're not seeing that, but I will talk about these studies during my presentation.
Great. So what you're saying is that the use of stimulant medications, I guess particularly, doesn't spur on the use of drugs or alcohol.
No, we're not seeing that, which is good news.
That's great news. So Brooke, is the risk different for teenagers versus adults?
So that's an important question. Our research has focused quite a bit on the developmental issues here because substance abuse changes as people age. It starts when teenagers are young, but it doesn't rapidly jump to an addiction or substance abuse. So if you try to measure it that way, you might miss it. So I'm going to talk about this because it looks a little different depending on the age of interest. So we are working hard to understand what that looks like at the different ages and what are the different factors that lead to this risk at the different ages. And we think that might have important implications for prevention and for treatment.
Great. All right, so we can learn a lot more from Brooke Molina, PhD. She'll be speaking at the 7th annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders, this coming January 15th to 17th. Thanks so much for being with us today, Brooke.
Oh, you're quite welcome. I'm looking forward to presenting.